My name is Rebecca Parr, and I work in the community with a new organization that I've started called Next Step Initiative. And you're going to interview my sister also. Her name's Addie, and she and I work together along with community partners. And the primary focus is getting folks into treatment. And it started out because I met with some of my artist friends, because in my real life I work with the opera theater program at the university. And I was talking with some friends of mine about what would it look like to bring about hope in a community where people feel hopeless and helpless if we incorporated mindfulness, meditation, and the arts. And so we had a couple of meetings, and I'm not the kind of person that likes to meet as much as I like to do. So I set up a big meeting in September of last year, and had a lot of people that were interested and came about and wanted to be involved, and my sister came. And she had something else in mind that she wanted to do, which was to go actually help people get into treatment. So she'll tell you more about what she does, but we got very involved. Prior to that, I was educating myself and going to everything I could learn about the opioid crisis. I had run for city council, and that was the main area of my platform, was to discuss what's going on in our community and region and country with the epidemic, and what does that look like in terms of the family structure, and what are we doing as a community to address that. And I saw a lot of people with blinders on, maybe intentionally, maybe not, maybe they're just not knowing what to do about it, or maybe it's not affecting them personally directly. But I'd lost a nephew and have a lot of nieces and nephews in addiction, and I'm raising my great nephew who was born addicted, and so he's 5 now and he's doing great, and his mom's doing well. But so I needed to learn as much as I could. So I go to every conference, everything that there is. But Next Step Initiative has had a lot of success. We primarily work with those who are the most disenfranchised, you might say, or have the least amount of resources. If they've got resources, we will definitely refer them to somebody who can help them. But if they don't have resources, we're taking them on, and we're doing everything we can to get them the help that they need. And my sister does kind of a surround case management, so they might have health issues or mental health issues, or it might be just as simple as they're hungry. We'll go take them food. So we do a lot. We also are involved with, we're trained to train for the Narcan distribution, and we're looking into the needle exchange. And what can we do to help, those who are most affected? We came from a background, as kids we were raised, our father was a drug addict in a biker environment, and so we're kind of fearless because those were the people that raised us, so we know a lot about that. And our father's motto in the family was, do as I say, not as I do. So we ended up pretty much good girls. Had some dabbling here and there with issues with drugs, but not really, mostly staying focused on being healthy.
Right.
So.
What is one thing you learned this week that really surprised you?
Probably some of the, like the rights that individuals had. There was one, I was informed when I did the Narcan training that I thought that you had more than one opportunity to make a phone call if you were trained in a home. Just say you're in a house where a bunch of users are, and somebody ODs and you make a call, you're not going to get in trouble once. So I need to research that and find out more. What does that mean if there's a repeat situation down the road and somebody else ODs and that same person makes a call? Are they held liable in any kind of way? And then the other thing that had to do again with law enforcement was, I need to learn more, but that somebody could be carrying a needle, and if they're on their way to trying to find a drop box or getting it dropped off, then they're not necessarily going to be taken to jail for paraphernalia or something like that. So we want to educate our clients as best we can, because we feel like there's so much emphasis on criminalizing addiction as opposed to looking at what does this mean to save lives. So we want to educate our clients as best we can so that they're not so much fear-based about things, and I think a lot of them are afraid to come forward to get help for fear of getting into trouble. And we want to try to learn as much as we can so that we're giving out the right and correct information so that we can help as many people as we can to not be driven by their fear in terms of not getting help, and so that we can just help everybody save as many lives as we can. This has been a great conference. One of the things I think that's been probably the most beneficial is coming together with people from other areas in Tennessee and even other states too, but just to learn some of what the practices are in other places, but also what the needs are, and so we can assess where we need to go from here. Our organization is Next Step Initiative, because it's not about where we came from or way down the road. It's about what's just the next step, you know. And so that's a lot of what's going on here, is networking with individuals who are also on that same course, trying to figure out what is the next step that we could do to save our people, families, and whatnot. Education is a big thing. We got to erase some of the stigma in the community, and because I was talking about the fear base of those who are addicted and some of the legal issues, but there's also a fear base amongst even some of your agency people that they could be held liable or accountable and not having the correct information for saving lives. Particularly, we were talking about getting Narcan distributed. That's vital. I think everybody needs to have it, and our Surgeon General has said, you know, all agencies need to be trained to have this, and I think that there's still a lot of fear amongst the agency representatives and even leadership that people could be held accountable, or that's too much responsibility to put on our employees. Well, there's a lot of mythology that we could demystify some of that mythology by education. So we're doing it, we're stomping, we're pushing our way around to make sure that we can get as many people educated as possible. So.
That's great. Do you have anything else you want to add?
No, thank you though for bringing this out and making sure that people will learn about this. I don't know what you're doing with this information, but I hope I've been able to help you with some. My sister will probably tell you more about the nitty-gritty, because she's the one who's actually got her feet most on the ground in there. I'm a little more lofty in my thinking, and you know, we both are visionaries. We both have ideas about what we want to do and what the needs are, but she's the one who's in there on a daily basis with people and helping them and talking to them and making sure that they know how important they are. So I'll let you talk to her.